Hello, my name is Josh Anderson, and this is my skills demonstration for oral cares, personal hygiene, and bed making. For the skills demonstration, I'm going to be using this stuffed rabbit to simulate my patient. To begin with our patient's daily cares, we would first introduce ourselves to the patient and go through what we're going to be doing and verify patient by their name and birthday. Patient has vocalized that they need to use the bathroom, so we'd wash our hands and provide gloves. We would roll our patient's blanket down. We would have our patient roll onto one side, placing a bedpan underneath the patient. If we had a male patient and they needed to, we would also use the urinal, placing the urinal in between the legs with the penis in the urinal. If the patient was able to hold the urinal themselves, then we could let them hold the urinal themselves. Cover the patient back up for privacy, and we would raise the head of the bed for to a comfortable level. After the patient is done, roll the blanket back down, take our urinal, record any output, and then roll the patient back and remove our bedpan. We would then clean the patient up as needed. And we get our patient back under the blanket. After completing, we'd wash our hands and then begin with their personal cares. So our patient would like to brush their teeth this morning, so we'd have the patient sit up to a comfortable level. We would get gloves on and then get the patient's their toothbrush and everything ready. We'd start by wetting the toothbrush and applying toothpaste to the toothbrush. While the patient's in a sitting position, we would have the patient open their mouths. With the toothbrush at a 45-degree angle, we would take and clean all surfaces of the patient's teeth, doing the top and bottom. We would offer a patient an emesis basin that they could spit out extra toothpaste. Offer the patient a cup of water to swish. Re-offer the emesis basin that they could spit out the water. And if the patient would like, we could offer them mouthwash. Once again, offering the emesis basin for them to spit out the mouthwash. Now, after that, we would gather our supplies to complete a bed bath for the patient. You would get a bath basin along with some clean washcloths, a towel, and bath blanket. So we'd have our bath basin with warm water in it. We'd start with doing facial care. Get a clean washcloth. We'd start with doing the eyes, making sure we're going from the inside to the outside of the eyes, getting a clean surface every time we wash the eye. and then we'd wash the patient's face. Now we would drape the patient in a bath blanket to help provide privacy. While completing all of their personal cares, you want to make sure that either the curtain is drawn around the patient or the doors are all closed. We'd use the bath blanket to provide additional privacy. Roll our comforter down to the base of the bed. Then we would only remove the area that we are going to wash from the bath blanket. So if we're going to start with our arm, we would take our arm out, tuck a clean towel underneath. Once again, get a washcloth, get with some soap. We're going to start by the shoulder, working our way down to the fingers. And getting in the armpit. Then we pat the patient dry. You could either take and then do one side of the body and then move to the other side, or you could work from top to bottom. So you could take and start next with the other arm, or wait and move around to the bed to do the other arm last. Take and bring our bath blanket down to have the patient's chest accessible. Again, we get clean washcloth with soap and wash the patient using nice gentle strokes. And then we pat dry. We're going to make sure to pat the patient dry and not take and rub dry, as the friction could cause irritation to the skin. Next, we'll do a patient's leg. Place the towel underneath the leg. Again, working our way from the top of the leg to the bottom using nice gentle strokes. And getting the patient's foot. Then we would pat dry. We would also want to provide peri-care for the patient. For peri-care, you're going to want to make sure you use a nice clean cloth. If the patient is a male and uncircumcised, you want to make sure that you gently roll the foreskin back, exposing the head of the penis. Start by cleaning the head of the penis and then work our way from the tip down to the base. And then you'd clean around the scrotum. If it's a female patient, you're going to want to make sure that you are getting a new cloth. You want to work from the front of the patient, clean from the front to back, getting a new surface of the cloth every time. You want to make sure we're getting inside the outer folds of the labia. After our patient, then we would take and roll our patient over, giving us access to their back. Place the towel behind the back, and wash the back, ending at the patient's bottom. And then pat dry. After we wash the patient's back, we would offer to apply lotion to the patient if they would like. This is also a great time that a nurse could use to inspect the patient's back and bottom area for any skin breakdown. After completing a patient's bed bath is a wonderful time to change the patient's bed sheets. Begin by removing the current bottom sheet on one side. While the patient is rolled over, we're going to tuck the old sheet then we would get the new fitted sheet for the patient. We would apply the new fitted sheet to one side of the bed. Tucking the new sheet underneath the patient. While the patient is on one side, we could replace the pillowcase over here. We would have the patient roll onto the new fitted sheet. We would then continue removing the old sheet as well as working the new sheet across the bed. And replace the other pillowcase. We would add the patient's top sheet. For them. Go to the other side. At this point, if the patient's comforter was still clean, you could reuse it. Roll the comforter back up. We would tuck our sheet in and then corner of the bed. Allowing the bottom of the sheet to stay tucked into the bed. Work our way over to this other side. Finish tucking and then grab down and complete the corner. And we could finally remove our bath blanket. Check to see if there is anything else that the patient would need at this time. If they don't need anything, we could give them the call light, have the bed adjusted to an appropriate height level for them, and then that would complete our personal cares, oral cares, and bed making for our patient.